Bertha James, 64 years old, accidental impalement on pruning shears, BP 138/74 and slightly tachy at 114. Already vaccinated for COVID. Okay, let's get up day 24.
Let's get these things out of me!
We will, but first you need a CAT scan and workup so we can figure out the safest way to remove them, okay? How bad is the pain?
Bad.
Okay, Tehran, can I get, what's the... Is everybody okay? You okay? Is everybody okay? We need help over here! Let's call him out. Let's get him out of here. Okay. Get maintenance down here now.
Are you kidding me?
Feel the excitement.
Excitement!
Okay, let's get him out of here.
Dr. Bloom?
Damn it, she's the Kipnik. Okay, let's get her on nasal cannula O2.
You think it was the shears?
They're nowhere near her heart or her lungs.
Hello? Somebody? It's just on my leg. You see this?
I got that on my arm.
We need to evacuate the ED.
Evacuate. Why?
It's not dirty water. It's a chemical spill. Okay, the sickest patients and those with the most chemical exposure go to the front of the line for decon showers, chest CTs, and arterial blood gases. Less acute are gonna have to wait. Mrs. Westbrook, how are you feeling?
Better. Blood sugar's down to 187.
Okay, that's what I like to hear. Low exposure, back of the line.
Dr. Blue, I ran the symptoms by poison control, and they suspect an herbicide called 4-methyl-2-chlorophenoxyacetic acid. Apparently, MFCA is odorless, colorless, and highly corrosive.
What a great trio.
Coming through. I put the ED on diversion and activated hazmat protocol.
Hazmat?
Busted pipe doused Bertha pretty bad.
Into the open wound?
Direct hit.
Since then, she's been tacky with runs of Y-complex VTAC.
Not to mention, this garden shear is still sticking out of me.
We're gonna get to those, but first we gotta take care of your heart and lungs, which means a decon shower to get the chemicals off your skin, and then some wound irrigation to get the rest of it out of your insides, all right? Just try to breathe.
Bertha's in, but we only have 2 showers. It's gonna take hours to get everyone through.
Okay, hazmat's bringing more tents with more showers. Until then, we just need to hold on.
I'm gonna go find where an herbicide van in the 70s is hiding in our hospital.
Just a couple more should do it.
Take your time.
BP 140.
Certainly don't worry about the shears.
We haven't forgotten. I promise.
No rush.
Once we stabilize your vitals, they are coming out.
Would you like more pain meds?
What I'd like is a hospital that's not falling apart. I mean, how can you even see what you're doing when the lights keep dimming? It's like a cavern in here.
Lights aren't dimming.
But why is everything getting darker?
Heart rate shows no distress.
You ever heard of MFCA exposure causing blindness?
I'd barely even heard of MFCA before it gushed all over my ED.
Well, Bertha's now experiencing complete and total vision loss.
She did take the biggest hit, had the most extreme exposure.
Well, I put her on dialysis to try to clean the toxins out of her blood, but look, if this is blinding people, then we need to get everybody decontaminated as soon as possible.
Oh, yeah, because up until now, we've been dragging our feet.
Hey, look, I'm just saying, there could be more surprises.
Got it. Thank you. Let's get this line moving, people. Come on.
Hey, you've had way more exposure than anyone else.
And your point is?
You need to be the next one into the decon showers.
Okay, I don't know how it works at Mount Zion, but in my ED, patients come first.
Radiology to the OR. Radiology to the OR.
Dialysis went great, Bertha. We're gonna give your site a little more time to reset, okay?
In the meantime, I'll just lay here and pale.
Not at all. Look, next stop, those shears are coming out.
I'm so sorry. None of this is your fault.
Don't worry about me. Just focus on you.
focusing on me is why I started gardening. My shrink said it's a way to tune everybody else out and hear the universe. I know it's hippie, but doesn't that sound nice? Hearing the universe.
It does?
I'm trying to hear it now, but these shears makes it kind of hot.
Whoa. Grab me 2 milligrams of Ativan IV.
Perimeter. On it. Can you get her back on dialysis?
It's too late. Her body's absorbed too much MFCA.
So where does that leave us?
Ativan is prepped. Base dose ready.
Dr. Reynolds.
And I don't know.
Standing by.
You're actually removing the shears? Floyd, it's too late for her. She's dying.
Because of us.
Wound channel.
We did this to her.
16 seconds.
This hospital, this building.
Hold off on the esophageal.
You know, Bertha said that the shears were making it hard for her to hear the universe. Well, if there's ever a time that we deserve to hear the universe, it's when we're leaving.
Staff's all through. After Miss Westbrook, it's just you and DeMarcus left.
Where is he?
He's around the corner, editing video of his head-on collision.
Still on? It's okay, I got you, DeMarcus. I got you. I need help over here! Tracy! A blood vessel damaged in your accident must have just given way. It's caused an expanding hematoma, and it is closing off your windpipe. I can fix it, okay? I can fix it. I just need to drain the blood. Casey! Help! Casey!
Come on, breathe. Come on.
PDC less than 20 and falling.
Indicates metabolic, not respiratory.
Her end tidal CO2 levels just went off a cliff.
Severe acidosis. Push 2 M's of bicarb.
Removing the shears caused a pancreatic storm.
This is not how she's going out.
Hey, you and the kids got this? I need to go get all doled up.
Yeah, get out of here.
Drive safe, boys.
Hey, genius, what do you got planned for us next year? What, are we gonna get our appendix removed?
I don't think we should go on these trips anymore, Dad. Clearly, you're getting too old.
Says the man in the wheelchair. What's wrong?
Bloom, get back here!
What happened?
He just started seizing.
Move that wheelchair. I need out of bed now.
Bloom.
I got him. Grab his leg.
I I bet a seizure is why the dad lost control of the car.
CTs?
Well, they look normal, but the CSF from the lumbar puncture showed white and red cells for both. I thought a hematologist should take a closer look.
It could be infection.
Or exposure?
Which is why I paged you both, and I believe in my heart of hearts that you guys are gonna figure it out.
You guys?
I'm late for a fundraiser, doctor.
Oh, that.
Guess who apologized?
No.
It was a sincere one, too. Really gushy.
How'd you feel about that?
I don't know. It was definitely easier getting over him when he was being a dick. Hey, you gonna come tonight?
I don't know. We'll see.
Come. We deserve to have some fun.
Because of your unusual symptoms, it would be helpful to know exactly where have you been and whom you have come in contact with.
Well, like I said, we've been outside the country.
Begged to go to Hawaii, but my son insisted on northern Canada.
We take a father-son adventure every year since my mom died. Every year, he complains.
Have you ever tried moose jerky?
I wanted to see the glaciers.
Yeah, what's left of them. The snow was so wet it was like trudging through a Slurpee. Sorry about everything.
They don't appear to understand the severity of their current situation.
Good. Let's keep it that way.
I believe this is nigraritis.
But there was no warm water for swimming up there. An arbovirus is more likely if there were mosquitoes around.
Perhaps we should test them for rabies if they slept in a room with a bat.
If they'd slept in a room with a bat, I'm confident we'd have heard about it.
So we do a full panel.
Dr. Kapoor, Dr. Sharp. The Americans have been moved into isolation, and here are their test results.
Could you get us hard copies?
Printers are down.
Get IT on those printers and find us another tablet, please.
Okay.
It's not nigraritis or botulism.
It's not anything. All their tests are clean. But something's wrong with them.
There's one possibility we have not yet considered.
Busy or anything?
We have 2 patients in isolation who are exhibiting identical symptoms. They recently returned from hiking the Canadian Rockies.
On melting permafrost.
We have tested them for every known disease, but nothing has come back positive. What's more, their condition is only getting worse.
Their BPs are falling and their fevers are spiking.
As more and more ice thaws, long dormant pathogens are waking up.
Are you telling me there may be some ancient disease floating around our hospital?
Yes,
Yeah,
we are.
That's about right.
Look, I'm not saying it isn't some ancient pathogen that we've never heard of, can't test for, and couldn't possibly treat. I am simply suggesting that we should focus on other diseases that we could actually, cure.
We've been through it, Max.
Vasculitis?
Their kidney function's fine.
Carbon monoxide?
Wouldn't account for the seizures.
Morantic endocarditis?
We'd have seen thrombotic vegetations in the CTs.
Mercury poisoning? I read the Arctic permafrost has something like 20 swimming pools of pure mercury.
The more the ice melts, the more mercury is released into the ecosystem. Our patients hike through, absorb it.
It would indeed fit the symptoms.
We'll work up a treatment of dimercapril right away.
Great. Then while you two are here heroically saving lives, I will be charming rich people out of their money.
Chris? Christopher! What's happening to my boy?
BP is bottling out.
Heart rate's climbing. There's blood in the urine.
His kidneys are failing.
What's happening to my boy?
BAL is tearing through his body. Pass me the ambu bag.
It should have been me.
It's not mercury.
It should have been me, I told you! You should have tested it on me! Is he gonna be all right?
We are in uncharted waters here, Mr. Markin.
But you have to be able to do something, right?
Your son's reaction to the BAL has provided us with invaluable information.
Information we will use to seek out another diagnosis.
So you really have no idea what we have or how to cure it?
No.
Every year, we take these adventures together, and I complain, and Chris complains that I complain. But the truth is that
I look forward to these trips more than anything in the world. But now that he's grown, that's all. It's the only time that I have with him. I don't get enough time. We just don't get enough time with our kids.
Well, finally, it's working. For God's sake. Useless technology. You were right.
What do you mean?
You were right from the very start. The technology got it wrong. Our test results got it wrong. Think about it. This whole time we've been testing for today's pathogens. But today's pathogens are all mutated, evolved variants of much older strains. What those men were exposed to up there was a much older strain of a very common infection.
So even if it were a 99% match, our equipment will still read it as a negative result.
Exactly. Their initial symptoms were telling you they were suffering from nagleriasis. Our collective wisdom and experience were telling us they were suffering from nagleriasis.
And our equipment could not see it.
This may be an ancient strain, but it's essentially the same old amoeba.
Which means today's treatment should still be effective.
Doctor?
What you got? An overprotective data bee who needs to chill out.
Her back's been sore and she's had these awful headaches and she's like forgetting things. She nearly fainted at the coffee shop.
It's called having a baby, Michael.
Vitals?
We found him right outside. We didn't have time.
All right, we got it. Thanks. How far along are you?
39 weeks.
You have a birth plan?
Yeah.
Any allergies?
No.
Complications?
Just having these really bad headaches.
Mom's blood pressure 290 over 160, heart rate 130, and fetal heart rate 90 and falling.
All right, trauma 1. We have to do an emergency C-section. Call OB, but I'm not waiting.
What, now?
What?
What's happening?
Is the baby okay? Michael?
Just breathe.
Michael!
Should I call her doctor?
PGA and polygalactic 9.
Is she okay?
She's sedated to help with the hypertension, but we need to get your baby out now for both their sakes. Retractor.
Richardson.
And where's OB? Okay, need a little help here.
Everything okay?
Got it? Hold it nice and
What's
wide
wrong?
for me. It's not.
Doctor?
See the cord? Keep trying.
Doctor.
Suction. Just a little more. Time of birth, 10:23 a.m. You have a strong baby boy. Give me those APGAR scores.
Yes, doctor. All right, I see that. Standing by. Birth weight, 7.6 pounds. APGAR.
Isn't he amazing?
I don't usually play favorites. Your son is perfect.
Sabrina, would you just give us a minute? Mr. Archer, I'm Dr. Goodwin, medical director of this hospital.
Is everything okay?
Your paperwork said that Lynn is your surrogate,
She's also my best friend.
but you paid her to carry the child?
Yes. We have a contract.
Yeah, I'm afraid that surrogacy contracts aren't valid in the state of New York. So by law, the baby belongs to the birth mother, and we can't legally give him to you without her permission.
Then just ask her. She'll tell you. What?
We thought delivering the baby would relieve Lynn's hypertension, but so far it hasn't.
We're doing everything that we can, but she hasn't regained consciousness.
Wait.
I'm sorry, Michael. I know this is hard, but the nurses here are going to take amazing care of him.
You can't be serious. You're taking him now?
Michael, listen to me. I'm going to do everything that I can to help you, but right now, we need to take him. We need to prep Lynn for surgery. We should know in an hour or two if the clipping has lowered her intracranial pressure. Dr. Kapoor will be overseeing that.
And our grandson, can we see him?
This is Dr. Fromm. I've asked him to consult on this case in his role as a child advocate.
Forgive me for asking, but you are aware that Lynn was not the egg donor for this baby? Yeah, that since she was just the carrier, she and this child are not genetically related in any way? Okay, good. I apologize for having to discuss paperwork at such a painful time. I really do. But if you take a look, please.
What is this?
It's a waiver Although Lynn and Michael shared a contract, surrogacy is still currently illegal in New York. But the good news is, as Lynn's parents, you can sign on her behalf to allow the father to take custody.
No.
Mrs. Sackhoff, this baby's father is sitting in my office waiting to hold his son.
I am not giving him to some stranger.
Mrs. Sackhoff.
Some man who pays women to carry children?
Ma'am, I know this is a complicated situation, but this child is not yours.
He is the last piece I have of my daughter.
He's our grandson, and we're taking him home.
Hey, how's it going? Well, legal put in an emergency injunction request for Michael. They've all made statements, so now we're waiting.
And, Lynn?
Still in surgery.
Frankly, Lynn Sackhoff's intentions are clear. The contract's claim is compelling. However, the interstate dispute here is beyond this court's remit. So I'm bound to issue an injunction I'd take no joy in making. Until the conflict is resolved by a higher court, neither party may have custody. The legal guardian will be the New York Department of Social Services. The baby is to be placed in foster care.
Your Honor, this child's genetic father is here begging to take him home, as are the birth mother's parents. And this court's answer is to send this wanted newborn into foster care?
It's the law. I'm sorry, Dr. Goodwin. My hands are tied.
This isn't over yet. Our legal team can file an appeal by tomorrow.
No, we'll lose.
No, you don't know that.
Max, do you think this is the first case like this? This is not unique. And while we're appealing, Robin will be in foster care, not for days, for months.
I know, it's unfair, and it's cruel.
Michael, if you let your son go to foster care, you will be introducing him to a world that is cruel and unfair. Far more cruel than this.
So what are you saying? I should just give up?
I'm saying you should fight. You should fight to give your son the best life that he could possibly have. Even if it's not with you.
I'm afraid the clipping procedure has not relieved Lynn's intracranial brain pressure.
Is there a cure?
Surgery to place a ventricular shunt in her head, but...
Excuse me. How is she?
We must prepare for the worst.
You've raised an amazing woman.
Thank you.
That's why I'm withdrawing my case. Can't grow up in foster care. My son, he needs to be with people who love him, even if that's not with me. And if you do as good a job with him as you did with Lynn, then he's gonna be... You hang in there, okay? I'll see you soon. Someone please tell Robin that his daddy loves him.
Michael! What you did back there? Lynn's parents want to talk to you.
We just wanted to hold onto our girl in case she doesn't wake up.
But we need to honor what she did while she was here. And what she did for you.
Are you?
Hey, little guy.
Construction scaffolding collapse near 46th and Lex. There's 5 more after this one. Okay, let's get him to Bay 23 and page ortho. Okay, we've got multiple burns. Let's start a line. I'm gonna be right back.
There's so much blood.
Okay, we just need some stitches, okay? Let's get her to Bay 29. Hang 2 liters normal saline, wide open. You see anything that interests you today?
Nope.
Always a pleasure, Dr. Shen. Okay, keep breathing, keep breathing.
Thank you, Oliver.
Anything to help.
Okay, you too. Just hang tight.
I need to perform a debridement on Lena Luzani, Bay 28.
Local anesthesia or top.
Little help here?
What happened?
No clue. His heart rate just fell off a cliff. No warning.
The same thing over here.
Bradycardia, need a crash cart stat. 2 more crashing over here.
What the hell is happening?
It's everyone who came in from the scaffolding accident. Casey?
These old pads are working for now. As if being crushed by falling scaffolding wasn't enough.
Whatever they were all exposed to, it's not messing around.
Yeah, the sputum sample should be back in a few hours.
Okay, well, until then, you, care to tell me why you and my mother were hugging?
Lauren, I already told you.
Oh, God, here we go. This is Jake Holstein all over again.
I feel like you want me to ask who Jake Holstein is.
No, I don't need you to ask. Jake Holstein was this super cool senior who liked me when I was a freshman. But every time he would try to hang out with me, he would get dragged into these long, flirty conversations with my mother. Because Jeannie always has to be the focus of every guy in the room.
I need a co-team here. Lena. Lena. Her heart rate just crashed out of nowhere.
Is she going to be okay? Working on it, sir. Please give us some room.
Sudden drop in heart rate, normal O2 saturation, same symptoms as a construction site.
But Lena came from me. She was never near that accident.
So whatever's happening to our patients, we're the ones doing it to them. Okay, we now have 14 patients who have crashed without warning. The spreadsheet lists every single medication they've received.
Find the common link.
They all got normal saline.
Well, apart from these 2.
What about Ativan?
No, Lena didn't get that. Oh, wait. They all had bandages?
Well, and alcohol swabs, but how would that make sense?
My patient's crashing. I need an epidrip in here stat. Let's get the drip started at 2 micrograms a minute.
Copy that.
Wild guess, his heart rate just plummeted out of nowhere?
Faster than a drunk on a mountain bike.
What drugs did you give him?
Shot of morphine from an auto-injector Y.
All our other patients were administered morphine using the same injector system.
It's gotta be our link.
You think an overdose?
Doesn't make any sense. These injector syringes come pre-filled at 2 milliliters. There's no way that 2 milliliters of morphine cause this kind of reaction.
Unless what's inside isn't morphine. Okay, Casey's at the lab with some of the pre-filled syringes. We'll see what they find out.
Well, if we can't figure out exactly what we're giving him, this man's gonna die right here on the table.
Mass spectrometry test results are going to take at least an hour.
Do you have a better idea?
I'm not sure it's better.
Lauren!
What is it?
It's morphine.
But it can't be, because then that means...
This isn't why our patients are crashing.
Heart rate's bottoming out.
Start with these.
No! Oh, the steering column's made of metal.
If the pads fire, then the charge will arc through his chest.
Well, that limits our options.
I'm cracking open his chest. I need a scalpel and a sonic bone saw.
I'll get him prepped.
I'm starting a mid-sternal thoracotomy.
Wait!
What are you doing?
What is that?
It's Narcan.
Heart rate's rising.
Saturation's up.
It's working.
How did you know?
That's more than 2 mLs of morphine. I'll wager it's 3 times that.
So it wasn't the wrong meds?
No. These pre-filled syringes were designed so we wouldn't have to think about measurements in the heat of a crisis.
And these ones came to us overfilled.
Which we would never have found out in time if you hadn't have popped one open.
We can't be the only hospital that uses these.
Sound the alarm. We have a Class 2 recall on our hands.
We'll take another one.
Get a resuscitation team.
Respiration shallow, weak.
Give me a CBC, BMP, Chem 7, and a saline lock. Anybody know who this is?
Found a boarding pass in his pocket.
Stop. Everyone, back away from the patient. Masks on. Now.
BSI protocol in effect. Check. Nothing left here.
This is Max.
We have a patient in the ED from Liberia presenting with all the signs of malaria, Lassa fever, TB, or
Ebola. The first thing we do is call the mayor's office and the CDC if we even suspect Ebola virus. Now, the patient is in an isolation chamber with negative pressure airflow. That chamber is equipped with every available medicine should the patient need to self-medicate.
What about us?
Ebola isn't airborne, but if you develop symptoms, you will join him. Until then, you will help him. Everyone interacting with the patient is required to wear personal protective equipment at all times, no shortcuts, ever. Good. Once blood is drawn, the test results will come back in 24 to 48 hours.
commencing a code green blood draw at 1:10 p.m. New Amsterdam Hospital.
Dr. Goodwin?
How can I help?
Dr. Kapoor's patient in 1208. He wanted to be kept in the loop.
Yes, thank you. How's she doing?
I think Dr. Kapoor is going to kill her.
Max, this is Detective Rose from NYPD and Agent Bratton from the FBI.
The CDC alerted us to your patient with Ebola.
We're still waiting on the test results. I'll be with you in 5
The
minutes.
NSA just intercepted a video made by ISIS. They claim they sent one of their followers from Liberia to New York City, infected with the Ebola virus. Your patient is now a terror suspect.
A man came to my village.
What was his name?
Ayan.
Last name?
I don't know. He was showing off money he made in America from selling kufi hats and dashikis in Times Square. He offered to give me clothes to sell and a plane ticket if I give him half of what I make.
And you believed him?
Yes. He took me to doctor for a traveler's vaccination.
Alan, where did Ayan want you to go when you got to America?
Youth hostel in Times Square.
Then why did you come here?
This is the only hospital in America I heard of.
He's not a terrorist.
We'll gather the evidence.
If he was a terrorist, he would have gone to Times Square where he could have infected the entire city, but he didn't. He came here to get better. He was clearly tricked into getting something injected into his bloodstream. You see that, right?
Dr. Goodwin.
Just please promise me you will look into his story.
I'll look into it.
Remote says he's crashing. Hey, can someone help me in my suit? Alon? Alon, you need to grab the oxygen mask. Alon? Alon, it is right above you. Helmet now. Forget it. I'm going in.
Dr. Bloom, wait.
Bloom! Get out of there now!
Too late! I'm already in. There's too much blood. I can't see anything.
rate is dropping. He needs adrenaline.
I can't stop bagging.
Adrenaline first, oxygen after. Okay, go. Okay, now push 10 mLs, open wide.
That's too much.
Not for this kind of virus.
It will send his heart rate too high.
Push 10 hard and fast, right now. Lauren?
I know what you're gonna say. That was stupid. I violated protocol.
Lauren. Your glove.
Doctor.
Alan, that shot they gave you in Liberia, they might have thought it was Ebola. But it wasn't. It was the Lassa virus, which is just as deadly. Except, as Dr. Bloom can tell you, the Lassa virus can be treated with antiviral medication, which we gave you.
Tears stream down your face when you lose something you cannot replace.
You wanna grab a drink?
Seriously? Now?
Talking about a nice glass of scotch. What are you talking about?
Yeah. Yeah, I could use a drink.